What is NuvaRing? NuvaRing is a simply unique, once-monthly birth control option that you administer vaginally. It's 99% effective, just like the pill, releases a low dose of hormones, and provides reliable cycle control. Once monthly dosing gives you less to remember and less to forget. It's a convenient option for a busy lifestyle, because women are busier than ever these days, and a daily pill regimen simply may not fit into your schedules. How do you use NuvaRing? NuvaRing is easy to insert and remove yourself and takes just a minute. Just pinch the ring and gently push it up into your vagina. The exact position of NuvaRing has no bearing on its effectiveness. Once NuvaRing is in place in the vagina for 3 weeks, it can be easily removed by you. Just hook your finger through the ring and gently pull it out. Then take a 1-week break for your period and insert a new ring. It's that simple. Wouldn't it be nice if everything were that easy? You'll be glad to know that NuvaRing is 99% effective at preventing pregnancy, just like the pill. Over 97% of women rarely or never had a problem inserting or removing NuvaRing. Most women don't feel it in the vagina, and during intercourse, most couples don't mind it. And NuvaRing can even be removed for up to 3 hours, and during intercourse. In fact, 9 out of 10 women who use NuvaRing would recommend it to others. See for yourself why so many women are finally satisfied with their contraceptive.
The first contraceptive pill received FDA approval in 1960. It contained only synthetic estrogen, and it worked by making a woman's body think she's already pregnant. That is, a woman naturally produces higher levels of estrogen when she's pregnant, and this prevents ovulation, or the release of an egg. However, the high levels of synthetic estrogen in the pill from the 1960s and 70s caused dangerous side effects. After many women began to suffer blood clots, heart attacks, and strokes, the pill manufacturers lowered the levels of estrogen from an initial 150 micrograms per pill to today's dosage of 30 to 20 micrograms. While this reduced the rates of side effects, it increased the rates of unintended breakthrough ovulations. In response, pill manufacturers added synthetic progesterone to the synthetic estrogen. The progesterone has 2 effects. First, it thickens a woman's cervical mucus to impede the movement of sperm en route to the egg. Second, the progesterone dries up blood vessels along the uterine wall. So if the sperm still reaches the egg and fertilizes it, the embryo has nowhere to implant, but is lost in a woman's menses. For this reason, the contraceptive pill also works as an abortifacient. This is a fact that pill manufacturers don't advertise or promote. Therefore, the goal of this video is to inform people of the truth and to remind them of what actually happens at fertilization or conception. Here, the 23 chromosomes from the man's sperm and the 23 chromosomes from the woman's egg unravel and recombine together so that the two become one flesh. This unique combination of 46 chromosomes then becomes the blueprint for every subsequent cell of that new person. It can't be determined exactly how often the pill causes an embryonic abortion. However, women who take the pill report that they sometimes skip days, or that they don't take it at the exact same time every day. This results in a failure rate of 3 to 5%. If therefore 3 to 5% of the women who take the pill still report a pregnancy, how many more women are having breakthrough ovulations? And of these women, how many are conceiving new life but are losing their embryos to the abortifacient effects of the synthetic progesterone? These are good questions. And if you want to read the source materials for this video, or to learn more about natural family planning, the holistic alternative to contraception, visit myspace.com/stopabortifacient. Thank you.
The intrauterine device, or IUD, is the most popular method of birth control in the world, with 160 million women relying upon it.
An intrauterine device, or IUD, is a T-shaped plastic instrument that is inserted into a woman's uterus to prevent pregnancy. There are two types of IUDs available in the United States, Paragard and Mirena. Paragard is an older form of an IUD that contains copper. Its presence encourages the body to release leukocytes and prostaglandins, substances that are hostile to both sperm and eggs or ova. Mirena does this as well, but it also contains progestin. This hormone decreases the frequency with which a woman releases eggs. In addition, Mirena changes the structure of a woman's cervical mucus, making it difficult for sperm to meet egg. Although both types have different methods of action, they are inserted in the same manner. A doctor measures the length and width of the cervix and uterus with an instrument called a sound. Then, a tube containing the IUD is inserted through the vagina into the uterus. Once there, the device's folded arms open up to a T-form. IUD insertion may cause pain and cramps, and some doctors recommend taking pain medicine prior to the procedure. It can also help to insert the device mid-cycle when the cervix is naturally dilated. Once inserted, an IUD is more than 99% effective at preventing pregnancy, lasting for 5 years in Mirena's case and 10 or more in Paragard's. Should a woman decide to have her IUD removed early, she might take up to a year to get pregnant. This long length of time, unobtrusive placement, and ease of use all contribute to the IUD's popularity. In addition, its $200 to $500 price tag makes it the cheapest form of long-term birth control in the United States. In addition, Mirena can reduce or even end menstruation within 1 year of insertion. Paragard, on the other hand, may increase menstrual flow by 50%. Also, in the unlikely event that a woman becomes pregnant while using an IUD, she is more likely to miscarry, give birth prematurely, or have an ectopic pregnancy, which is a dangerous condition whereby a fertilized egg develops in a fallopian tube. To avoid a pregnancy, it's important for a woman to wash her hands, insert her finger into the vagina, and feel for the string between periods, thereby ensuring that the device has not moved. Intrauterine devices are incredibly effective and very popular. However, they do not protect against sexually transmitted diseases. Talk to your doctor about the pros and cons of an IUD.
Want to learn more? Check out other videos and sources on this site for more information.